Krabbe disease, also known as globoid cell leukodystrophy by Sarah Whitney. Krabbe's disease is a rare genetic disorder of the nervous system. It is a type of leukodystrophy. This disease affects muscle tone and movement and may even cause more devastating effects such as vision and hearing loss. In most cases, this disease develops in babies before they're 6 months of age, although it can occur in older children and in adults. In the United States, Krabbe's disease affects about 1 in 100,000 individuals. A higher incidence of 6 cases per 1,000 have been reported in a few isolated communities of Israel. This condition is inherited in an autosomal recessive pattern, which means that both copies of the gene in each cell have mutations. The parents of an individual with an autosomal recessive condition each carry one copy of the mutated gene, but they typically do not show any signs or symptoms of that condition. If both parents are carriers normally conceived, their child has a 25% chance of being affected, a 50% chance of being an asymptomatic carrier, and a 25% chance of being uninfected and not a carrier. Some of the symptoms of early onset Krabbe's disease consist of changing muscle tone from floppy to rigid, hearing loss that can lead to deafness, vision loss that can lead to blindness, failure to thrive, feeding difficulties that may require tube feedings, vomiting, irritability and sensitivity to loud sounds, severe seizures, which may begin at an early age, and unexplained fevers. Late onset Krabbe's disease symptoms consist of vision problems, which may appear first, followed by walking difficulties and rigid muscles. Symptoms vary from person to person, and other symptoms may even occur. A mutation in the GALC or the galactosylceramidase gene on chromosome 14 causes Krabbe's disease. Persons with this gene defect do not make enough of a substance called galactocerebroside. The body needs this substance to make myelin, the material that surrounds and protects our nerve fibers. Without it, myelin breaks down, brain cells die, and nerves in the brain and other body areas do not work properly. Unfortunately, there is no specific treatment for this disease, and usually death occurs within the first 2 years of life in early onset Krabbe disease. In desperate attempts, people have even tried bone marrow transplantation in the early stages of the disease to try to arrest the progress of the disease. Generally, treatment for this disorder is symptomatic and supportive. Physical therapy may actually help maintain or increase muscle tone and circulation, but in the end, there is essentially no cure for Krabbe disease.